effective for joint pain. Now, many a times when we go to a doctor, if you are suffering from, say, joint pain, whether it's an acute injury or you've had it for a while, you might have the doctor say, we need to give you an injection into your joint. Now, it can be quite a scary thought, and it can be quite overwhelming as well. And you might have a lot of questions like, is it really worth it? Is it going to give me pain relief? Is it going to get me back to my normal everyday activities, whether it is walking or climbing steps, or say going back to sports if you're a sports person, or just your normal, workout in the gym, etc. So let's address some of these common questions, and then you can decide for yourself whether the injection is worth it in your scenario, in your present situation. So for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work as executives. And because we all know working as an executive is a highly stressful job, you have mental and physical stresses, and of course, being a mom is never easy. So we have a lot of physical changes that we go through as moms. And it could be that these physical changes manifest as neck pain, back pain, etc., or a poor posture when you are sitting at your desk for your 9 to 5 jobs or long meetings or extensive traveling. So basically, everything put together, there's a lot of aches and pains around, and then um, obviously these pains are going to distract you from being a good mom, from being a good worker at work. Okay, so being performing at work basically. So I help you manage all these with simple solutions and easy tips. So one of the things that moms usually suffer from is joint pains. When you go to the doctor for your joint pain, now this could be any joint, we're not talking a specific joint, it could be your neck, back, mid back, knee, elbow, anywhere, heel for that matter. So if you have a problem or you have a tendinitis, that is uh, inflammation in a tendon, like some people when they're playing too much game or they're typing too much, or uh, they get this inflammation around this tendon is basically this ropey part of the muscle here. So when they get inflammation in that area, the doctor might advise you to go get an injection. So firstly he might tell you, okay, do some take some medications, do some physical therapy, do some exercises. If it doesn't work, he might send you for an injection, or the doctor might straight away tell you, go for an injection. Okay, so usually these injections would be steroid injections. Now, the moment we hear the word steroid, usually the alarm antennas go up and you're like, no, I don't want steroids in my body. So remember, when you're having that one-off steroid injection, it's not going to lead to, most probably it's not going to lead to serious complications. Now, the reason I said most probably is every one of us is different, and most of the times it's quite it's quite safe. Obviously, your doctor decides when and what dosage and what exactly, when exactly do you need the injection. But I'm just covering the peripherals, the overwhelmed part of it. So, okay, I lost my train of thought there. So, okay, let me go back. So yeah, if you you're supposed to go for an injection. So the doctor might have already sent you for physical therapy, or might be saying, okay, take an injection and then go for physical therapy. So if that is the case, you need to talk to your physical therapist, or or the exercises that you're doing, consider those. And what happens with the injection is, once you get the injection, sometimes it's an immediate reaction. Sometimes it takes 3 to 7 days for your joints to settle down after the injection. You will experience pain relief. Some people have like a 90% pain relief, some have a moderate pain relief. It really depends on what is the uh, pathology, what is the problem that's going on with your joints. So when you get this pain relief, this is your golden time, the golden time to do your exercises, to do whatever physical therapy you're going through. And it is the time when you are going to be maximally pain free. Is that even a word? Anyway, maximally pain free in order to do all that you need to do for your joint. This is the one mistake that people do. They think, hey, I'm pain free, I'm cured, there's no problem happening, let me go on with my life as normal. And they just drop all the exercises, all the precautions, everything in the background. So do not make that mistake and treat this as your golden time. So, yeah, I was saying talk to your doctor, your physical therapist, and then see if they can give you some intensive, not intensive, but some, they can up your level of exercise. Or probably if, say, you have been waiting to do a certain, say you're just on stretches for your tendinitis, right? The inflammation in the tendon we're talking about. So you are just on the stretches, but they probably want to start you on a strengthening program that needs more effort on the part of your joints. Then this is a good time to do that. So talk to your doctor, talk to your physical therapist, most probably your physical therapist, and see what they say from there. I'm just looking at my notes here. So yeah, so usually people are scared of injections because they have heard that steroids lead to weight gain, but it's just that one-off injection of steroid. Maximally, I mean, the maximum limit is usually about 3 injections in a year. At the max, the doctor might go to 4 injections, but usually the doctors try and limit it to 2 to 3 injections in a year if you actually need that many. I mean, in any part of your body, because usually the injection, if you take repeated injections, they can lead to weakness in the structures of the joint and in the muscles. So usually the doctors themselves will not over prescribe the injection for you. So that's basically one of the fears around the injection. I'm just looking at my notes here if I have missed anything else. Oh yeah, so how the injection helps you, I'm sure your doctor will ask, I mean, advise you. And I'm sure Dr. Google out there, you must have Googled it already. But usually, what it'll do is it will ease off the inflammation in the area. It helps your body, gives it that boost to heal the area. And basically, it helps you with pain relief because of that. So, that's a very simplified version of how the injections can help you. So, if your doctor has advised you an injection, go talk to them. If you have any questions, come back to me. I'm happy to answer and help you out in whatever way I can. And talk to your physical therapist and consider the exercises you're doing now. Do you want to go up one level? Now we're not talking gym exercises. We're talking like restorative, rehabilitative exercises here. All right. So if you guys are looking for simple solutions to manage your joint pain or your neck and back pain, I have a free community where I talk about these topics on awareness and on simple solutions to manage your pains. For example, now in my community right now, I am doing a free training known as simple solutions to manage your tennis elbow pain. So we have covered a wide variety of topics that moms usually have a problem with, like heel pain, ankle pain, back pain, etc., etc. So I will leave a link in the description of this video. And those of you who are watching me on Instagram, the link is in my bio. So when you click on it, it opens a new page, and then you scroll down to my community. You can join from there. And yeah, that's it for today. I hope this was useful and it helps you overcome that overwhelm with the injections. All right.